Looking for the best tips to lower cholesterol without relying solely on medications? In this video, a medical expert breaks down 5 science-backed lifestyle changes that effectively lower LDL, bad cholesterol, and improve heart health. These methods are ideal whether you're managing cholesterol naturally or taking statins. Don't miss these vital tips to protect your heart and live longer. High cholesterol is one of the major risk factors for cardiovascular disease, the leading cause of death globally, according to the World Health Organization. Elevated levels of low-density lipoprotein, LDL, often referred to as bad cholesterol, can increase your risk of heart attacks, strokes, and peripheral artery disease. While medications like statins can be highly effective in lowering cholesterol, many people prefer to start with natural, lifestyle-based strategies or use them to complement existing treatments. Here are 10 medically recommended, evidence-based tips to lower cholesterol that have been shown to work in clinical studies. Tip 1. Eat heart-healthy foods. One of the most effective tips to lower cholesterol, backed by clinical research. Changing what's on your plate is one of the most powerful steps you can take to lower your cholesterol naturally and protect your heart long-term. Here are the most evidence-based dietary strategies recommended by cardiologists and nutrition experts. 1. Reduce saturated fats. Scientific insight: saturated fats increase LDL, bad cholesterol, which directly contributes to plaque buildup in arteries. According to the American Heart Association, limiting saturated fat intake to less than 6% of total daily calories can significantly reduce cardiovascular risk. Avoid or reduce red meat, beef, lamb, pork, full-fat dairy, butter, cream, whole milk, fried or processed foods. Replace with lean poultry, low-fat dairy, healthy plant oils like olive or canola. 2. Eliminate trans fats completely. Health risk. Trans fats are among the most dangerous fats for your heart. They not only raise LDL cholesterol but also lower HDL, good cholesterol. In fact, the US FDA banned trans fats from partially hydrogenated oils as of January 1, 2021, due to their strong link to heart disease. Still, be cautious. Trace amounts may remain in some processed foods. Always read labels and avoid anything with partially hydrogenated oils. 3. Eat more omega-3 fatty acids. Omega-3s don't lower LDL cholesterol directly, but they reduce triglycerides, lower blood pressure, and help prevent blood clots. Excellent sources include fatty fish, salmon, mackerel, sardines, walnuts and chia seeds, ground flax seeds and soybeans. A meta-analysis in the Journal of the American College of Cardiology confirms that omega-3 fatty acid consumption is associated with lower cardiovascular mortality. 4. Increase soluble fiber intake. Soluble fiber binds cholesterol in the digestive system and helps remove it from the body before it enters the bloodstream. High-fiber foods include oatmeal and oat bran, legumes like lentils and kidney beans, apples, pears, Brussels sprouts. A review published in the American Journal of Clinical Nutrition found that 7 to 10 grams of soluble fiber per day can lower LDL cholesterol by up to 10%. 5. Consider adding whey protein. Whey protein, a byproduct of dairy, has been shown to modestly lower both LDL and total cholesterol, and also reduce blood pressure in people with hypertension. In clinical trials, whey supplementation improved lipid profiles, especially when combined with a low-fat diet and exercise. Best used as a daily shake or smoothie ingredient, especially if you're replacing a high-fat or high-carb snack. Improving your diet is one of the most powerful tips to lower cholesterol, and it doesn't require drastic measures. By cutting saturated and trans fats, adding omega-3s and fiber, and considering whey protein, you can make a measurable impact on your heart health, often within 6 to 12 weeks. These changes are especially beneficial if you're also on cholesterol-lowering medications like statins. They enhance the effects and reduce the need for higher doses. Tip 2. Exercise regularly to improve your cholesterol. One of the most powerful science-backed tips to lower cholesterol and boost heart health. When it comes to tips to lower cholesterol naturally, regular physical activity is one of the most effective, and most accessible lifestyle changes you can make. How exercise affects cholesterol. Clinical research has consistently shown that moderate to vigorous aerobic exercise can raise HDL cholesterol, the good cholesterol, lower triglycerides, improve the LDL particle size, making it less likely to contribute to atherosclerosis, aid in weight loss, which in turn further improves lipid levels. A landmark study published in Arteriosclerosis, Thrombosis, and Vascular Biology found that even modest increases in physical activity can lead to measurable improvements in cholesterol profiles, especially HDL. How much exercise is enough? According to the American College of Cardiology and the Centers for Disease Control and Prevention, CDC, aim for at least 150 minutes of moderate-intensity aerobic exercise per week, e.g., brisk walking, or 75 minutes of vigorous aerobic activity weekly, e.g., running, cycling. Pro tip: you can break this into manageable chunks. Even 10-minute sessions spread throughout the day can add up and yield significant health benefits. Easy ways to add more physical activity. You don't need to join a gym to start seeing benefits. Here are practical ways to get moving. Take a brisk walk during your lunch break. Bike to work or for short errands. Play a sport you enjoy, like tennis or pickleball. Do active chores. Vacuuming, gardening, or even dancing while cleaning counts. And remember, consistency beats intensity. It's better to move daily than push too hard and burn out. Stay motivated. Behavioral studies show that social support significantly increases the likelihood of exercise adherence. Try teaming up with an exercise buddy, joining a walking club, fitness class, or sports league, setting weekly goals with a tracking app or smartwatch. Motivation grows with progress, and the rewards are profound, from improved cholesterol to better sleep, mood, and blood pressure. Whether you're managing cholesterol with lifestyle changes alone or taking medications like statins, exercise amplifies the benefits and improves long-term heart health outcomes. Tip 3. Quit smoking to improve your cholesterol and heart health. One of the fastest-acting tips to lower cholesterol and reduce your cardiovascular risk. When people think of smoking, they often associate it with lung cancer, but its impact on heart health and cholesterol levels is just as severe and often overlooked. The cholesterol connection. Smoking lowers your HDL cholesterol, the good cholesterol, while simultaneously damaging blood vessels and promoting inflammation in arterial walls. This accelerates the buildup of plaque, atherosclerosis, dramatically increasing your risk of heart disease, heart attacks, and stroke. According to the American Heart Association, quitting smoking is one of the most immediate and powerful changes you can make to improve your cardiovascular health, especially when you're trying to lower cholesterol. Health benefits begin almost immediately. Here's what happens after you quit. Based on clinical research, within 20 minutes, your heart rate and blood pressure begin to normalize from the nicotine-induced spike. Within 3 months, blood circulation improves and lung function begins to recover, making physical activity easier and more effective, which in turn helps raise HDL cholesterol. Within 1 year, your risk of coronary heart disease is cut in half compared to that of a current smoker, as shown in long-term studies published in the New England Journal of Medicine. What the science says. A study in the Journal of the American Medical Association, JAMA, found that former smokers who quit for a year or more had significantly higher HDL cholesterol levels than active smokers, even without changes in diet or exercise. Moreover, smoking cessation reduces oxidative stress and inflammation, both of which are major drivers of high LDL cholesterol and arterial plaque formation. Pro tips to quit successfully. Quitting smoking is tough, but far from impossible. Modern support options can dramatically increase your chances of success. Nicotine replacement therapy, NRT, patches, gum, lozenges, mobile apps and text-based programs for daily tracking and motivation. Cognitive behavioral therapy, CBT, or counseling. Talk to your doctor about prescription medications like varenicline or bupropion. You're not just quitting a habit, you're adding years to your life and directly improving your cholesterol profile. If you're looking for effective tips to lower cholesterol, quitting smoking should be at the top of your list, especially because the benefits start within minutes and continue for years. Not only does it help normalize HDL cholesterol levels, but it also supercharges your cardiovascular recovery and cuts your risk of heart disease in half within 12 months. Tip 4. Lose weight to lower cholesterol naturally. One of the most impactful tips to lower cholesterol, with lasting heart health benefits. Even a modest amount of weight loss can significantly improve your cholesterol levels. That's not just theory. It's supported by decades of clinical research. Why losing weight matters. Excess body weight contributes to higher levels of LDL, bad cholesterol, triglycerides, and total cholesterol, while also reducing HDL, good cholesterol. But here's the good news. According to the National Heart, Lung, and Blood Institute, losing just 5% to 10% of your body weight can lead to noticeable improvements in your lipid profile and reduce your risk of heart disease, high blood pressure, and type 2 diabetes. Simple strategies that add up. You don't need a crash diet. Sustainable daily habits are more effective. Try these expert-backed changes. Cut empty calories. Replace sugary drinks with water or unsweetened iced tea. Choose air-popped popcorn or plain pretzels over chips or fried snacks. Satisfy sweet cravings with low-fat treats like sherbet or naturally low-fat candies, e.g., jelly beans, but watch the portion sizes. Move more throughout the day. Take the stairs instead of the elevator. Park farther away from entrances. Take short walking breaks every hour at work. Do household chores or light yard work. Even standing while cooking burns more calories than sitting. A study in The Lancet confirms that daily lifestyle movement, not just structured workouts, contributes significantly to long-term weight loss and cholesterol reduction. Tip 5. Drink alcohol only in moderation. One of the most misunderstood tips to lower cholesterol. You may have heard that a glass of wine is good for your heart, and there's some truth, but also a lot of caution needed. What the research shows, moderate alcohol intake has been associated with a modest increase in HDL, good cholesterol. Some studies, including those published in Circulation, show that low to moderate alcohol use may offer limited cardiovascular benefit. But, and this is crucial, the potential benefit is not enough to recommend alcohol to anyone who doesn't already drink. The risks of drinking too much. Excessive alcohol intake can raise blood pressure, increase triglycerides, lead to liver damage, heart failure, and stroke. Interact dangerously with cholesterol medications, e.g. statins. According to the Centers for Disease Control and Prevention, CDC, moderate drinking is defined as up to 1 drink/day for women of all ages and men over 65. Up to 2 drinks/day for men aged 65 and younger. 1 drink equals 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of distilled spirits. Bottom line from a medical expert. Weight loss and alcohol moderation are critical components of a successful cholesterol-lowering plan. Losing even a few pounds can rebalance your cholesterol profile and protect your heart. If you choose to drink, do so in moderation, or consider avoiding alcohol altogether if you're managing high cholesterol or taking medications. Combined with a heart-healthy diet, regular exercise, and smoking cessation, these lifestyle adjustments offer a powerful, non-pharmaceutical way to lower cholesterol and reduce cardiovascular risk.